We are here today with Elena, and my name is Pat. Today we will be going over the pre-screening and questionnaire lab for risk stratifications. First, I want to say that this class is going to be conducting a lot of labs for HWHP 609. With that being said, this is the release form for Elena due to the Morehead State release and liability form. Elena, the purpose of this, so that way I can explain for the video, is that due to these labs, there will be activity involved within these labs. So this is why we have you sign the release form. Okay. Also, she had signed and dated the back as well. The purpose of this lab, Elena, is that we will be going over your medical history. So I have a questionnaire here for you to assess your health status. What I want you to do is I want you to take some time to read through these, and the whole point of this is to get a background of yourself for your family's history, medical history, your current up-to-date history, and anything that I need to be made aware of during this assessment and these labs that we'll be conducting. Okay, so before we do that, go ahead and show you the questionnaire, and go ahead and take a minute to read over those. If you have any questions about anything, you feel free to ask. Okay, so now I will go over the questionnaire with you. Okay, so for your family history, you haven't had anything such as a heart attack, heart surgery, or pacemaker or anything like that, so that's really good. She hasn't checked any symptoms. An example of some of the symptoms would be chest discomfort or unreasonable breathing, so that's really good. Other issues, she has no checks there, so she doesn't have diabetes, or she doesn't have sensation in her lower legs when she's walking, any pain like that. She's also not pregnant. You're not taking any types of prescriptions or medications. The only thing that she did check for cardiovascular risk was that she does not know her current cholesterol level. So, Elena, with you not knowing your current cholesterol level, that would be a risk factor for you. So that would be one risk factor. The reason that it is a risk factor is because since we don't know the current level that you're at, we go ahead and count that as a risk factor because it's better to prepare for something being bad than to just go ahead and say, well, if you don't know, it's not a big deal. Okay. One thing that I would suggest is that the next time you go to the doctor, or if you were thinking about getting a checkup, ask to have your cholesterol level taken. How old are you?
20.
20? Okay, so that would be a good time to start having your cholesterol level checked and everything. So the next time you go to your doctor, you may want to ask to see what your cholesterol levels are or have them check that, just that way you know. With this, though, according to ACSM, there are 3 levels of risk stratifications. Okay, so you would be what would be considered a low-level risk stratification because you only have one risk factor. People that have 1 to 2 risk factors, they will be in what is known as the moderate level, just because there is a higher increase for potential heart problems or cardiovascular risk factors. And then anybody that has 3 or more risk factors would be known as what would be a high level. So anybody that's a high level, we would have to have them go and get a physician's release before they can actually participate in any of the physical activity that would be involved in the labs. So with you being at a low level, you are not required to go and get a physician's release or go and get checked up before you can work out. The only thing that I do advise you to is go and just get your cholesterol level checked whenever you do go to the doctor next time. Okay. This completes the pre-screening lab of risk stratifications. And once again, this is Elena. I am Pat. And thank you for your time.